I'm Lance Arnder. I'm chairman of the Department of Radiology at Wayne Memorial Hospital and a member of Wayne Radiologists here in Goldsboro, North Carolina. A CT angiography is a way of imaging vessels in the body, most commonly arteries in the body, the legs, the chest, the abdomen, the brain, and the neck. Liquid contrast is administered through an IV in the arm, and this type of angiography is in contrast to catheter-based angiography, in which a catheter, something about the size of a piece of spaghetti, is placed via an artery, usually an artery in the leg overlying the hip, to inject contrast. And one of the major advantages is that the patient can go home immediately afterwards, as opposed to the conventional type of angiography in which the patient would have to stay 4 to 6 hours afterwards to make sure that they don't develop a hematoma from the puncture of the artery. So with a CT angiogram, the patient can just simply leave the hospital with a Band-Aid on their arm after the procedure. Most patients who are getting angiography for diagnostic purposes, that is, when there's no intention of doing treatment at the time of the study, will have CT angiography. If it's known that the patient has a stenosis and the intention is to treat the stenosis either with an embolism coil or a stent or an angioplasty balloon, those patients will usually have a conventional angiogram before the procedure because it's necessary to access the artery to perform the treatment. Therefore, an angiogram could be performed without any change in the procedure. The machine is much more open than an MRI scanner, but it is like being in a large donut. Most patients don't develop claustrophobia. It's sufficiently open that most patients feel comfortable. But the scan itself, after an IV is placed and the scan is prepared, only takes 20 or 30 seconds. And the patient can get up, have a Band-Aid placed on their arm, and they're done with the procedure. For example, a CT angiogram of the chest, the arteries are very apparent and look something like a tree with branches. And what we're looking for is really a filling defect or an area that doesn't become bright with contrast, and that would represent a clot in the arteries. CT angiography has another advantage over conventional angiography in that in addition to imaging the vessels, which is all you will really see with a conventional angiogram, you get for free an additional look at the other tissues. That is the lung tissue around the arteries, the heart. We work with the physician who sends the patient to us to provide him with a report and with selected images that allow him to understand whether there's a disease or whether there isn't disease, and if there is disease, what the extent of the disease is and the distribution of the disease. CT angiography has replaced methods in the past that were not as accurate in identifying problems. I remember one case recently where a patient came in to have a CT angiogram of the chest and incidentally was discovered to have a lung tumor that was small enough to be effectively treated and would not have been discovered without the CT study.